Today's topic is pre-veneered stainless steel crowns. And I am privileged and have the honor today of having Dr. Matt Enns on the program with me today. How are you doing, Matt?
Good, thank you. How you doing?
I'm doing amazing. So you are doing pediatric dentistry up at a place in Washington called, I think it's Wenatchee Valley Dental Village. I looked up a little bit on the internet, watched a couple videos, and man, it looks like it's like Disneyland Santa's Village. Tell us a little bit about your place and how you got up there.
Well, in 2000, Dr. Tom and Tim Reynolds, they're twins, Loma Linda grads, and they decided to reimagine what pediatric dentistry could look like up here in Washington. And they had the vision of, yeah, Disneyland, classic architecture, patient experience, patient first, family first. And they just want to take that experience and make it so much better. So that's really started in 2000, and here I came in 2018. I've been enjoying pediatrics ever since, and it's funny when you go through those general practices and you're focusing on cosmetics, and for me it was implant, pros aspect, that kind of stuff, heavy stuff. I always got the families with the children, and then I started getting more children, and then in practices with multi-docs, I was getting all the kids, and then I was bailing them out of things with their kids. And so since graduation, ironically enough, that was my first choice for specialty in undergrad, well, pre-doc. And that's where I am now. And I think it was just kismet. It's just meant to be.
In a big practice like that, I'm sure you do your fair share of crowns, and you were doing a lot of pre-veneered crowns. Why did you end up deciding to switch from pre-veneered to Zirconia, Sprig crowns?
Well, I mean, and no knock in the tech at the time. It was fantastic at the time. I came in when a lot of docs in my community and at the forums I was part of were focusing on composite crowns, and they were discussing the aesthetics versus pre-veneered stainless steel crowns. And then I heard the whispers of these zirconia crowns, and I was like, well, that just makes sense to me coming from that implant, the pros, the cosmetic side of it, especially for posterior solutions for my adult patients, especially the bruxers, that kind of stuff. So somebody said zirconia, and I was like, well, I'm game. Let's figure out how this works. And then the more I dug into it, the more EZPedo kept coming up. Gold standard, EZPedo. There's nothing else. And I was like, okay, well, that's not the brand we're using. And how can we move towards this? And of course, in small areas, you end up receiving patients from each other. And so then you start seeing these cases. I couldn't believe it. I tell you, some of these kiddos, I get in my chair and they're smiling and they're happy and their teeth are beautiful. And I'm like, man, this low carries risk, guaranteed. I look and then I take my mirror and I realize it's a crown I'm looking at. So congratulations, you've gotten me on multiple occasions. Yeah.
Have you seen any changes in how parents respond, or what's the impact been on the practice?
Nothing but positive. The impact of these crowns in the practice has been tremendous. When it comes to the technology behind these zirconia crowns, it matches up with the aesthetics, and then it matches up with the treatment planning. And when all of that passion pours through you, as you're describing this to the parents, they know it, they notice it, and it almost gets emotional sometimes when you get to be that passionate about a product that you're describing to these parents. And they're like, I don't even need to see it. I trust you. And when you can do that day in and day out, you know, it's not an unfortunate thing that they have circumferential decay around their anteriors. Now it's an easy thing. You just describe the treatment plan, you're passionate about the product, and you just describe how great it's going to look. Your assistant is on board. They're already like kind of getting you out of the way to be, no, you got to listen to me. This is so amazing. You're going to love it. You won't even tell. And in fact, it's going to improve aesthetics, which when you look at those pre-veneered stainless steel crowns, there's always compromise. There's always yeah, it'll still be white until they laugh and they lift their head up, and then you'll see that silver in the back. So now it's more like the older siblings are jealous of the younger siblings if they're in the room. I've had that. I don't know if you've seen that.
Yeah, I have.
So the word of mouth has grown tremendously, not only through the passion of presenting this treatment modality, but the aftermath. And you see them even a day post-op. I've seen them a day post-op, and I'm just blown away.
Tell me why you have referred some of your colleagues to Sprig to choose EZCrowns. What was the reason behind referring friends to? Because sometimes dentists are like, well, man, if I refer my friends, there's going to be competition and that stuff. Doesn't sound like that's the way you look at it.
No, I think, and naively so or not, I've always been of the mentality that when you strive to achieve a goal in unity with the people around you, whether it's colleagues or people that could be perceived as competition, there's enough patients that need care that if you can work together and treat all of those patients, you're only going to be successful, and you're only going to lift each other up. And so when you're bringing your fellow colleagues in a tight-knit community up, and you're increasing the standard of care, and you're raising the treatment modalities to a protocol that they can easily implement, and that you have a complete faith in that modality, and now they do, it's infectious, and more dentists in the area start to see that. And then if they're being left behind with a certain product, whether it's composite crowns or ceramic veneered stainless steel crowns, they start to see these kiddos come into their practice, and they're like, oh my goodness, I got to do that now. And there's no question, in our state, in our certain area, when you look at the fact that only 57% approximately of these kiddos are being treated, period. Like that's the only information I got. And we're all being very good stewards of, dental education and oral health. And you still only have 57% of these kiddos that are being taken care of. It will only benefit everyone if everyone is doing the best they can. And with a product like this, you have kiddos driving in from 3-4 hours away, and they have a delamination or a fracture of a composite crown or something like that. That's tough. You don't want them to go through that, especially in a winter season. We get all 4 seasons here, and you're looking at things in your treatment planning like success rate and the failure rate of other things. And when you look at the success rate of these zirconia crowns, I mean, there's nothing better. So we're decreasing the amount of post-op visits where these patients have delaminations, and the parents freaking out because now it's like it's not aesthetic, but they're worried that something else has happened. And so this is one of the things that, yeah, I'll scream it from the mountaintops. It's an amazing product, but not only because it looks great and the gums are healthy around the crowns and it's amazing and it's like magic, but because you're preventing failures now that are easily preventable with a different modality, and this is the modality. So that's why.
Yeah, I say that all the time in what I do. The best way to prevent a problem is to never have the problem, right? So I think what you're saying is, hey, if I choose a product that I know is not going to have those problems from the beginning, I can really, do a lot better. Well, you said something I think that's really, really important, and that is, and this has been true, I've been out in private practice now for over 20 years, and this is one thing that I've never seen fail. And maybe it comes from that service to others background and stuff. I know that you mentioned that we both had going through Loma Linda University, is that when you put others first, when you really honestly want the best for them, it comes back to you. It does. You can't give too much without it coming back. And so I think that's a great place to end here. I thank you so much, Matt, for being on the program today.
Thank you so much for having me.
It was great having you here. Thank you, viewers, for being here with us. Again, if you have questions or if you have challenges, you can email me at jeff@sprigusa.com, and we'll see you guys next time.